Hello, my name is Ryan Long. This is my video Verbal CET. Today, my patient was Calvin Umbuyuma. He's a 42-year-old male. I did not catch his allergies, and I can't go back to check them, but I would say them here if I could. His admitting diagnosis was that he had shortness of breath and pleuritic chest pain, and his patient history is that he had HIV. For a summary, he arrived with the shortness of breath and chest pain, and he has a suspected TB infection. Over the course of his stay, he will be under isolation precautions with negative pressure room, and he has been started on IV broad spectrum antibiotics. He is currently at a 5 out of 10 level of pain with a 91% O2 level on room air. He has 22 respirations per minute, and his lung sounds were heard with crackles and rhonchi. He had a chest x-ray, and the results came in with patchy infiltrans, in the upper right lobe. For medications, he is currently on PRN pain medications, the broad spectrum antibiotics, and antiretrovirals for his HIV infection. I did not get any information regarding his cardiac function, his skin, his GI or GU, or his mobility, unfortunately. For labs, the only labs that were provided was his ESR levels, which were 90.4 millimeters per hour, and CRP, which is 67.2 milligrams per liter. For action items, we will continue to monitor his airborne precautions. We'll continue to monitor his O2 saturation, and we will continue to monitor his respiratory status. For the situation monitoring, if his condition deteriorates, we will implement higher level respiratory support for him, and I will continue to watch for signs of sepsis. Now, his priority problem is he has impaired gas exchange related to pulmonary infection, as evidenced by crackles and rhonchi when auscultating the lungs. For his individualized pathophysiology, it is important to note that he does have HIV, which is the reason why he was probably more susceptible for developing TB or any other respiratory infection. For his plan of care, I will continue to monitor his respiratory rate, his pattern, and his breath sounds, and his levels of O2. I will try to collect, while I collect the sputum culture to put in for a lab, I'll note its color, its amount, and if it has any blood in it. I'll continue to monitor his pain, and I will also monitor the things that were not assessed previously, such as his heart, his skin, or his level of mobility. For nursing interventions, I'll continue to maintain the airborne precautions and make sure that the negative pressure is on, for everyone in the room to wear N95 masks, etc. I will encourage him to have fluid intake. I will continue to administer the meds that were ordered, especially the his HIV medications, as well as the broad spectrum antibiotics. I will continue to monitor his O2 saturation, and I will educate him on the importance of his medication adherence. For his medications, as I said, we have initiated the broad spectrum antibiotics and his HIV medications, but for anticipated, we might have to anticipate more specialized antibiotics, especially if the result is not TB as we expected. And for labs, we need to take sputum culture to determine what it is. For collaborating disciplines, it is important for us to get into contact with the infectious disease section to determine what type of disease he has. And it's also important for us to get into contact with dietitians to know what he should be intaking to help fight off this infection. Something that he's a risk of developing is an acute respiratory failure. This is because if his TB or whatever else infection progresses, it can continue to build up in the lungs, including more alveoli or even entire branches, which can lead to even more reduced O2 levels, leading to him to developing a respiratory failure. To prevent this, we will to monitor his respiratory rate, his levels of O2, signs of perfusion, signs of cyanosis, signs of altered levels of consciousness, and signs of weakness. For his health promotion, it is important to note that he is an HIV positive patient, so he needs to have long-term adherence to his medications. It's also important to educate him on the dangers of infections, particularly for him because of his HIV status, and how sensitive and important it is for him to stay clean. I'll also emphasize the importance of nutrition to bolster his immune defenses. And I don't know about any drugs he might be taking, like smoking. He did not report any signs of smoking or alcohol use or whatever, but if there's anything else that can compromise his immune system, I will advise him to cessate that. For resources, I will recommend him to go check out the CDC website on their tuberculosis page. It is a very useful page which can get him into contact with a bunch of different resources related to TB, help him understand exactly what is TB, what it does, how it affects, how it can affect him more specifically because of his HIV, data that he can access, and multiple different tracking information regarding it. For the competency 5, I went with cultural considerations. Calvin is Kenyan, and he even went to check out his mother in Kenya, which is where he got HIV in the first place. He didn't elaborate too much on exactly what cultural considerations he would need. He did mention things using some herbal medications such as St. John's wort, but that's more the reason to ask him if he has anything, such as if the facility feels safe for him or if a different environment would feel more comfortable while still adhering to the negative pressure and isolation requirements. The importance of his family. After all, he did travel all the way to Kenya just to visit his mother. I'm sure that the isolation precautions can be very hard on him, so especially so because of his culture. So I can help alleviate that by giving him more access to maybe some family photos or easier ways for him to contact other members of his family. I can also maybe get him some more traditional herbal medications, even specifically ones from the region of his culture, which he might be more comfortable with taking. And I will also assess how he feels about regular medications such as HIV medications and how he usually adheres to that, so to maybe educate him about how not taking certain medications can potentially lead to a increased risk of infection. that is all for my video Verbal CET. Thank you for your time. I hope you have a wonderful rest of your day and have a nice day. Goodbye.